So instead, what we do is we adjust very gently, very specifically. So it's using the pressure like you push on your eyeball is when we're checking these babies and adjusting these babies. And what we're doing is allowing restoration of function, restoration of motion in the spine, allowing normal alignment to be restored in the spine. And why that matters is it allows the nerves to start to communicate normally. When your nervous system is able to communicate normally, babies can grow. They can grow healthy, they can function, and then all this tissue will start to heal as a result of having the alignment of the spine, and most importantly, the nervous system communicating to the muscles, to the tendons, to the organs, to the ligaments of that tissue in that area as well.